Welcome to Clyde Ellis Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Clyde Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Gina Pennell and Kijowski are nurses at DeGraff Memorial Hospital in North Tonawanda. Thanks for joining us today, guys.
Thanks for having me.
So if you can, first, let's start with Gina. If you can, tell us how long you've been a nurse and how long you've been working at DeGraff.
So I've been a nurse for about 6 years now. It'll be 6 years this spring. And I've been at DeGraff come summer, it'll be 5 years.
Okay, great. Caitlin, how about you? How long have you been a nurse and how long have you been working at DeGraff?
I've been a nurse just shy of 7 years and have been working at DeGraff for 4.5 years.
Okay, well, so let's take what everybody's wondering about, and people want to hear from the front line. They want to hear what it's like dealing with this pandemic. Let's start with maybe when you guys went through nursing school, and that's why I started there. Is it's probably not something you thought you'd have to deal with or that you trained for. You obviously deal with emergencies on a regular basis, but this is now, a public health crisis. So, Caitlin, let's start with you. Did you ever think you were going to have to deal with something like this, something so drastic, so severe?
I don't think any of us really expected anything on this magnitude, but in the same sense, what we're doing at the bedside is we're empowering our patients, giving them the information that they need to stay safe, such as like washing their hands, washing down surfaces, safe social distancing, and that's going to be the key to really beating this together, is empowering our patients through the community.
Gina, how about you? You've been a nurse for quite some time now, and you had the training, but did you ever think that it would get to this type of public health crisis that you'd have to deal with and actually be on the front line?
Well, I teach you all about, public health crisis and kind of natural disaster nursing, very briefly in nursing school, but you never actually think that it's going to be, during your career, but, it happens and here we are, but we're making the best of what we can and doing our best, just like Caitlin said, to educate our patients to help get us through it.
Gina, stay on that for 1 second. So tell us a little bit about the patients that are coming through. What are you seeing for the patients coming in through the ED?
Well, the patients seem to be taking extra precautions on their own end. Most of them arrive to the emergency department already wearing a mask, and most of them utilize the hand sanitizing stations right away as soon as they walk in the door to get their temperature taken, which it's very encouraging because if you see that level of commitment on the community side, it only helps us do what we do better at the bedside.
Caitlin, how about you? What do you see when the patients come through? How are you handling, their fears, their stress?
Right. I feel like everyone is a little bit hypervigilant at this point, healthcare workers and our patients. But, making sure that we're all staying on the same page, talking about the plan of care, and again, going over like thorough infection control guidelines, I think really will help us and the community flourish and beat this virus.
So you guys both really are talking about being focused on the patient and helping them, but this obviously takes a toll on the workforce as well. The long days, the stress, the anxiety. If you can, well, start with Caitlin. Tell us what it's like being in the middle of this, and how have you dealt with some of the stress and anxiety?
I feel like being in healthcare, you have to learn how to separate yourself. So when I go home, I try to do things that I like to do. I like to be out in the garden, but unfortunately it's been snowing a little bit. So I'll try to pass the time with things I like to do. Like I like to watch The Office on Netflix or, talk to family on the phone. Just really connecting out and reaching to others has been getting me by and keeping me sane during all of this. And of course, my work family too.
Gina, how about you? How do you deal with the stress and the pressures? Obviously, this is a tendon filled with some anxiety. How are you dealing with it?
Well, I just think it's important to focus on, just like Caitlin said, work stuff stays at work. Of course, being in nursing, your family is always going to run to you with the questions and, what's been going on. But you try to just keep an open mind. When I come home, I like to just spend the quality time with my daughter who's not in school and my husband when he comes home. So you just try and lean on your family for support when you have to have the stresses from dealing with the questions from your family and having it be your work life as well. So it's a balance, but strong family is important, and we have a really good strong work family as well to rely on. So
yeah, you both have mentioned the importance of the work family. Yeah, you guys do spend an awful lot of time together throughout a shift. Is there strength in numbers in that sense, in terms of you guys are going through this together? I mean, it's a very, very stressful time. Caitlin, tell us why that's important.
Well, our department has really good chemistry. We all get along very well. We work together as a team, and sticking together during the tough times is what gets us through. You gotta, be together, stay strong, and embrace the good and bad times together.
Gina, how about you? Tell us a little bit about your coworkers and how you guys have kind of managed through this as a team.
Well, if you ask anybody that walks into the doors that works at DeGraff, they'll say right from the get-go that we're more of a family than anything, because we're a small department, a small hospital. So by nature, we just cling together like a family. So we do the best we can. We support each other. We try and minimize each other's exposures. We help each other out as best we can. And we learn to laugh at silly things and, work together during the hard times too.
So I'm going to ask you guys both a question I'm sure you get asked every time you go home, every time you're talking to someone on the phone or texting you or FaceTime or Zooming. What's it like dealing with this issue? What's it like being in the front lines? So, Caitlin, let me start with you. What's it like? I mean, what do you tell people when you come home from work or when they're asking you how it's going at work?
It can be stressful at times, but if people are engaging in social distancing, only going out for the essentials, that's really what's gonna, cut down and save our healthcare workers. Listening to our elected officials, Governor Cuomo, he's putting all that information out there that our community needs to adhere to make sure that we all stay safe. I mean, we want this to end as soon as possible. So as long as we're staying on the right path, that's going to be key to things going back to the new normal.
Sure. Gina, how about you? When people ask you, what's it like, working with coronavirus patients? What's it like working on the front line? What do you tell them?
Well, at first it was very nerve-wracking because there was a lot of new things we had to implement, new screening tools, a lot of education on PPE and what to expect from the patients. But eventually it becomes kind of part of your normal routine. You get into your groove, and we know how to take care of these patients. It's what we are trained to do, and we do the best we can. So that's really all you can do in a situation like this.
So as we wrap up, well, let's stick with Gina here. There's been an awful lot of outpouring of support from the community. Each hospital has seen, various community organizations and restaurants step up. Tell us a little bit what you guys have seen. So Gina, what kind of community support have you seen, and how has it impacted how you guys have been able to deal with this while at work?
It might almost be easier to say what kind of community support we haven't seen, because we've been overwhelmed with the support from our community, whether it's a restaurant from down the street or family members, friends that are donating their time, masks, our coworkers that are taking time on their days off to make, head coverings like what Caitlin's wearing right now. It's very overwhelming and very heartwarming to see the support from the community. If there's one thing I can say is that it's always nice to feel appreciated no matter what field you work in. So in a time like this, the appreciation we're being shown is just so heartwarming.
Caitlin, how about you? How about the community support that you've seen?
Like Gina said, I mean, what hasn't been done by our community? I mean, there's been such love, kindness, support, and we really appreciate it. We don't consider ourselves as heroes. We're honored to serve our community, and it's been very amazing to see the amount of support that individuals in Western New York has done for us. And we asked them to continue to stay well and stay healthy.
Absolutely.
Caitlin Kijowski, Gina Pennell, working on the front line in the middle of coronavirus at DeGraff Memorial Hospital. These are historic times. Guys, thanks for joining us. Thanks for helping us tell the story. Thanks for sharing your stories with us today.
Thanks for having us.
Thank you so much. You guys stay healthy.